Congratulations, Dr. Makkar, on your book.
Chalo.
Yes, please.
Yes,
We
you
would
will
like to unveil. Wonderful. Congratulations once again. Sir, can you please sign it for us? Welcome to the show, Dr. Makkar. This is our first episode, and we are so pleased to have you here. So, before we begin our show, I just wanted to understand your story. How did you get into homeopathy for veterinary animals?
Okay. Thank you, my for his protocol for giving this opportunity. Um, I have come to this in veterinary homeopathy not by the way, but intentionally. On the first day I go join the service, I go to one case of mastitis, in which there's a problem of mastitis, and we have cured it at allopathic medicines naturally that way, penicillins and the steroids and everything. The animal was recovered fully. But after 3 days, the owner came to me and he said, he started me. And I said, why are you putting me? The medical officer was sitting with me at that time, in the evening time. So he started eating. When you ask him, why are you eating? I have treated your cow and your cow is perfect. He says, yes, you have treated my cow. But there's no milk now. Oh. The milk has completely died. Now what I will do? This is my family, and I am my family has bought up this from the last, you can say, 12 months. We are feeding, we are doing everything, and now she's not giving any milk now. How will we live at home now? So that was the hurt of the stone. Then my colleague also says, medical officer also says, okay, so such something. While we feel things, there should be no uh, change in the quantity and quality of milk. So that there should be no change in the quality and quantity of milk. That's the main point. So I have searched for other therapies like the Ayurveda, like some friends of mine, Siddha also, some of friends are in homeopathy also. Then ultimately I got results in homeopathy, and that's my turning point. That's how I turned to be a homeopath. Then I started taking a lot of cases with mastitis, thousand and thousand cases I treated with mastitis. And the most perfect part of homeopathy is okay, it has no side effects and the quantity and quality of milk remains same. That is the beauty of the homeopathy in treating mastitis. And economically, yes, homeopathy is very, very much cheaper than allopathy system of medicine.
Yeah. So, sir, how is it applied in veterinary sciences now? Is it you think it is a regular practice, or there's a lot of thing that needs to be done? Homeopathy in veterinary sciences.
Yes, we are applying. Actually, one should study the concept of homeopathy first of all. Every vet should study. If he studies, then he should learn how to take the case. Because in homeopathy there are certain things. Because homeopathy is there's no anti thing. There's no antibiotics. You can say like that. So everything is similar. Similar are treated by similar. That is the thumb rule of Dr. Hanneman. That is you have to similacus similar treated by similars. That is the main rule of the homeopathy of Dr. Hanneman. So, in while applying in homeopathy and veterinary side, we have to take the case perfectly. This means we have to take every constitution of the animal. Constitution means how the animal is behaving, how the animal is, what is the animal is made from. Its behavior, its modalities, its concomitants, and it is then symptom wise. When we search for certain symptoms, we should search for PQR. PQRS is the symptom, that is clear, rare, uncommon symptom. Suppose I have treated one case of a parrot he was from Raipur. And the owner says before his treatment, the parrot wants to remain outside the cage. But after it gets disease, now it wants to remain inside the cage. So this is PQRS system. In allopathic system of medicine, we didn't care about whether the animal wants to remain outside cage or inside cage. So they say if we go to the mind systems are we have to take in a very prominent way in veterinary homeopathy. So over here, the mind system is now the parrot is being afraid of coming outside. He's thinking if he comes outside of the cage, he will be killed. Right. That is his mind system. And on this mind system, we have given him this medicine arsenic galley. And that's how it is cure. That's how this homeopathy work wonders sometimes. But you have to find every time you have to find the constitution of the animal. Every time you have to find the PQRSU symptoms, and you should know how to take the case. Like we have to every time we have to take the case. Like we have to find LACM, that is location, etiology, concomitants, and modalities. Every time we have to take LACM into account. That is location, etiology. Etiology means why, where, what? If it is due to parasite, if it is due to fungus, if it is due to some metabolic disease, why this disease is. So every time we have to find the etiology. Then concomitants, they are unreasonable attendants that has no correlation with the pathology of the animal. That is concomitants. In homeopathy, we have to take into concomitants also into account. And modality. Modality means what the animal do to relieve himself from the how he feels better. Suppose he's in pain, so he will start rolling. Okay, but in homeopathy, the special one is if we suppose in horse, but there's a lot of problems in horses colic problem in horses. So when he starts rolling on the right side, medicine is separate. When he starts rolling on the left side, medicine is separate. That is the beauty of the homeopathy. Like when the same in case of dog and cats. If they start get PK, they will start jumping, they will start rolling down, they will start rising and doing like that. So from that point we come to know how this dog and cat is behaving and how it feels this colic. Yeah. So basically, LACM is what? LACM is very important. That's location, etiology, concomitants, and modalities. And the symptom should be PQRSU symptom. PQ? RSU. RSU. Yeah. Peculiar, cure, rare, uncommon symptom. So, Dr. Makkar, can you tell us what motivated you to write this book and tell us more about this book? Okay. Actually, when you look into the available books in India, especially veterinary homeopathy, there are no much books, and the books which are available, they are from Western writers, and some of the conditions they are not fit into in any. That's why I was thinking of writing this book. And earlier, there's one Dr. P. K. Green who had written one book on veterinary homeopathy. So he was my senior. So he promised me you should write also one book after me. So he has put more on the material medical side, less on the therapeutic side. So the material medica or therapeutics, how they differentiate? Material medica means when we talk about only about the medicines only, remedies only. Like arsenical, criteria, barb, silicia, and all the properties and the supplies. And in this book, this is book only, but this is practical guide on veterinary homeopathy. This means this is only practical book, in which I have tried to cover 481 disease conditions. Oh wow! Right from A to Z. And it covers all types of animals? Yes. Okay. It covers almost all types of animals, which I encountered, you can say like that also, which I treated. This is by personal experience. I'm not written in this book out of me, which I have not treated. I have treated these conditions in all species of animals, right from sparrows also there, parrots also there, then this tortoise is also there, and dogs and cats are the main reason where I'm got to note on these things. And animal sides, all type of animals, right from sheep and goats also, then this poultry also, commercial poultry farms also, then this uh, a large animal like cattle, cow. And in India, our total economy of our country depends on the cattle section. That's right. Cow and buffaloes. And this is the major contributory of this in GDP of India. So that's why it is very, very important our farmers should adopt this approach because this is very, very economical. And second reason is this is you can say it is very safe. And in statistics particularly, I stand to say this thing. Okay, the quantity and quality of milk remains same. So that is the beauty of homeopathy. That's why we have a doctor homeopathy and we have a teaching homeopathy and we are motivating every this farmer of our country to the homeopathy system of medicine. So, Doctor, what do you recommend? This book is for practicing veterinarians or pet owners or animal owners can also have this book. Who do you recommend should be really going through this book? Yes, this book is as well as good as for veterinarians also, and as far as good for uh, animal owners and this farmers also. I have kept in my mind that our farmers should use this book and they will certainly we are going to benefit from this book. I'm very sure. All right, all right. Yeah. So, moving on to my next question, Dr. Saab, is what do you say that how will homeopathy fit into the holistic approach in animal healthcare? We've seen wellness, we have seen allopathy, somewhere I think Ayurveda also is there. So how does this fit into animal healthcare? Yes, this is very good question, and and thank you to say this thing. Nowadays there is a word of integrated system medicine. So nowadays it is a system of integrated system of medicine. So we should have this approach in which we can utilize any pathway. We have taken as a veterinarian, we have taken the oath to treat the animal as a whole. We have not taken any oath we should treat this animal with allopathy or Ayurveda or other system of medicines. We are supposed to treat the animal. That's the main issue. Yeah, that's a wonderful thing actually. Yeah, treat the animal as a whole, not a specific system of medicine. That's great. That's great. That is the main issue. Nowadays, this system is being utilized by old system of medicines. Okay? We are supposed to heal. We are supposed to relieve the animal from its pain. That is the main system of medicine. That is the main fundamental system of medicine that works on that principles. Okay, we should relieve the animal from pain, any pain. Right. Whether due to disease or whether due to anything. What is the disease you as you know? This is dis-ease. Yeah. Disease is dis-ease. Yes. When you are dis-ease, it means you are diseased. Yes, yes, yes. So when our animals they are suffering this pain, they are dis-eased. So we should treat them with any system of medicine. We should not. That's why we call it a holistic system of medicine. We can treat integrated means we can use allopathy also. We can use Ayurveda. We can use homeopathy. So as you know, every system of medicine has its limitations. Like allopathy has its own, Ayurveda had its own, homeopathy its own. In homeopathy, biggest limitation is it is the individualistic medicine. Yes. We have to take the case every time. You can't give the same medicine for the same condition to every animal. No. You have to find the reason. You have to find the constitution of the animal. You have to take the case LACM. You have to find the PQRS system every time. So here is the main question. That's why homeopathy is it is very effective, you can say, but at the same time we have to take a lot of pains. Because you can't say if there's any colic and you start giving in every animal this colocin and diosera like that. No. You have to take the case every time. It may be treated with Naxomic only. It may be treated with Maxelf only. It may be treated with very basic remedies like arsenic alba also, colchicum also. You have to find the etiology every time. Location, etiology, LACF. That's right. We have to find the fundamentals. Yeah. Right. If, if we work on the fundamentals, homeopathy is very, very helpful. And if we say, no, give any medicine, no, it's not going to work. We have to read lot of things. We have to read organome of the medicine. We have to read ephemerism of the medicine also. We have to read materia medica in full. We have to remember every and each medicine. That's the beauty of homeopathy.
So to follow up on this, as you said, you have to read. So if a veterinarian or if a pet owner wants to know more about homeopathy in animals, or if they want to do some kind of courses, are they available? Or if they want to study, where are the places they should look for this courses?
Yes. For veterinarians, this is particularly courses are only for the basic education is in veterinary science. And nowadays it is available only in Kerala till date. In that is Manmuti University, Kerala Veterinary and Animal Sciences University, Manmuti. They are giving this CSHBM course, that is certificate certificate course in veterinary homeopathy. Certificate course in veterinary. PGCVH. They are giving PGCVH, that is postgraduate certificate in veterinary homeopathy. Right. And same wise, I come to know that there are so many universities now. They are going to start the course. Last time we have visited Pondicherry, and they're going to start this diploma course. And one of the our university, Gadbasu, that is Guru Angad Dev Veterinary and Animal Sciences University, Ludhiana. They are also going to start this certificate course. And Bikaner is also in the queue. They are also saying they are also going to start this veterinary course. Now, nowadays it is a part of curriculum. It is a part of homeopathy and Ayurveda. Now becomes a part of curriculum of a PGSE and HCROM. That is, in basic graduate level, we have to study this veterinary practice, Ayurveda, and homeopathy as well. So that's why more and more universities are coming up to offer these courses. And these courses are only for veterinarians. Okay. And so, when it comes to holistic medicine and with specific reference to homeopathy, what is the advice you would like to give to young veterinarians that how should they begin? One, of course, you said they should go through this certification program, but what else do you recommend and give advice to these veterinarians? There are a lot of courses in worldwide also. There are so many universities which are offering these courses also, so short-term courses and long-term courses. But in India, this is a very good courses. But I think, according to our Indian Veterinary Council also, we should possess some extra degree also for it, certificate course or diploma course. I think this is Ayurveda, either this is homeopathy, or either an acrobatic practice. So we should acquire these certificates also in order to give a better and better services to our farmers of our India. Basically, we veterinarians and we are working for our farmers of our India. That is the main principle of our life. So Dr. Makkar, another question I have here is that, see, in other, I don't know if it is very allopathic or Ayurvedic, but you have these supplements and you have these vitamins and something you take to keep yourself well. It is not related to, being diseased or anything, but you just take these vitamins and supplements. And you just told me that you are also, you've worked on the, old age issues of animals and how to treat them. So, is there some kind of a supplementation available in homeopathy? Is there some supplements for animals specifically? No, you can't say like that. Just in form of supplements, but there's one more biochemical medicines are there. That is 12 tissue remedies in homeopathy. Right. They are basically spoken. This children every time they suffer from this when their teeth are becoming in their young age in their when they're teething, teething effect. Yeah. So we give them every time we give them calcaria fast 6 hours.
Yes.
So that is their tissue remedies. So they are also there and they are working very nicely. And when we combine all, they are also working like that. So they are tissue remedies. They're basically you can say they are supplements. You can say like that.
So, what is this? Can you tell us something about this research you have done on old age and animals?
In old animals, we have done this research on 82 this dog and cats. There are the 53 dogs and 29 cats, on which we have done research for 2 years. And we have found that when they become aged, there's certain lot of problems in them, especially this problem of arthritis is there, yes. Then this diabetes there, and some this hypertension is also cardiac problems are there. Then this chronic kidney disease is probably too much prevalent in them. Then epilepsy cases are also there. So all these, when we address them with other systems of medicine, they may cause some harm or they have some side effects. Because homeopathy has very least or you can say no side effects. That's why it works nicely and in the old days it gives very, very good results. And from this paper I have submitted this worldwide also. So this is giving very good result, about 75% results in dogs and 76% results in cats during my study. That is the beauty of the homeopathy.
That's that's wonderful. And just to wrap up this session, my last question here would be, which is like probably top of the mind for a lot of animal lovers, is how exactly can we use homeopathy for free roaming or stray animals, specifically dogs? Yes. How can we use it? Because as you said, every dog, every animal is
Yes.
specific. But how can we use, and
Yes.
what are one or two things you can tell people
Yes.
that they can use?
Yeah, this is very, very important. From all the questions, this is very, very important because we are living in a society where there is everything is there. Our these animals got accidents also. Yeah. Our animals get diseased also, and their stays also. There are too much stay these dog and cats in all over India. This is from in all over India. So what we are doing over there, suppose that I have we have taken certain cases also with the help of NGOs like scabies. We have treated these scabies formation in the dogs. It is a infectious disease, you can say like that. If any healthy animal comes with in touch, it gets this infection, this scabies infection. Okay, so that's how this disease is going to spread and spreading. So we have taken these projects at the mass level, and in those cases, we have given this Suriname one at 1 week. On Sunday, we all the animals on the uh, on the roadside. Yeah. And then the next week again on Sunday, we call those animals again, and we with some putting in some drops of milk and water. We mix that medicine and we feed to all the animals.
So we can give it milk. We can give it milk. Okay.
Yes, yes. Okay. That is very, very economical.
Okay. Yes.
And if you treat the case of scabies, and ultimately you can't catch that dog and cat. But when you give homeopathy, it is very gentle. They will they take in small numbers of pounds very easily. Yes, and this is very, very economical. Yes. And if the cost wise, you can say this is only 5 to 6 rupees per animal. So cost wise, if you give this treatment in allopathy and in other system of medicine, the cost might be goes up above 500 rupees per animal. But over here, the cost maybe 10 rupees only, 10, 15 rupees only. So that's why it is very, very economical.
Yeah. So you recommend that you mentioned sodium. So can we give it just like that? Let's say I have 3, 4 street animals who I think are suffering from scabies. So we can give it sodium 1 ml 1 week, and then for another week.
For next week, this week in acid flow.
Acid flow. So 1 week it is sodium, and the second week it is acid.
Only 1 day.
1 day. 1 dose basically.
1 dose only, and 1 week, next day, the next week, only 1 dose of the acid flow. And next week again, sodium. Next week again, that will be repeated, and that is within 6 weeks, animals are cured.
Cured. Okay.
That is beauty of homeopathy. We have taken these projects and we have put up the research papers also.
Oh, that's wonderful.
Yeah,
That's
we have
wonderful. So this is definitely
yes,
going to be very, very beneficial,
yeah,
specifically
yeah,
for the free roaming or stray animals.
for the stay animals. Yes, this is very very important because dogs and cats, they are parcel and part of our life nowadays.
Yes.
So everybody is looking after this. So there are a lot of NGOs, a lot of people who are working. They are not getting food for themselves. But I have seen so many cases in Kolkata where the people, they come up with so many things for their pets, not for themselves.
Yes.
That is the beauty of the loving of the animals. And that is increasing day by day. In Kolkata, I have seen people are after the animals like anything.
Thank you, Thank you, Dr. Makkar. Thank you so much for your time. It was really pleasure having you, and we look forward to another session with you. And all
Thank
the
you, ma'am.
best, and keep on doing the good work.
Yeah. So thank you, Deepali and Manisha, and my furries.com, and doing this platform to express my feelings.
Thank
Wow. Bale, bale. That's my attitude.
Yes,
We should live like in a good mood. I always keep smiling.
Thank you so much.